A young lady presented to the clinic last week complaining that she couldn't see well during the night or when it was getting dark. Anytime it was getting late towards evening stroke night, she finds it difficult to tell the details around her environment, to see clearly, which wasn't the case before now. After saying her complaints, we asked her some questions about her family, if there's anybody else in her family that have experienced something similar, and she said no. So we examined her, we checked her vision in the clinic. It was still okay. She was still seeing pretty well during the day. And then we went ahead to dilate her, and so we could examine the back of her eyes. By the time we looked, we saw some darkish things at the back of her eyes. For context, this is what a normal eye looks like, the back of the normal eye. But this is what our patient's eyes looked like. Have I seen something like this before? Yes, several times. This condition is called retinitis pigmentosa. It is a genetic condition. That means it doesn't have to do with the food you eat. It doesn't have to do with your environment. It doesn't have to do with any of those things. It is just strictly your genes. In the course of my career, I have seen several patients with retinitis pigmentosa, and there are different patterns of inheritance. There's the one whereby mommy and daddy has the abnormal gene, but they're only carrying the abnormal gene. They themselves are not manifesting the disease. When they cohabit and have a child, one or more of their children can carry the two abnormal genes together, one abnormal gene from daddy and one abnormal gene from mommy. And then that child will now be affected with retinitis pigmentosa. But some other children can be lucky. They can carry one abnormal gene from daddy and one normal gene from mommy. And those children would also be carriers, just like their parents. And then some children would just carry two normal genes from their parents, and those ones would also be normal. And that's why sometimes you see some children, for some diseases, some of them are affected and some of them are not affected. For example, sickle cell disease. This one is called a recessive mode of inheritance. In another pattern, the parents are already affected. For example, mommy is affected or daddy is affected, and they have a child, and then they pass on the affected genes completely to their child. Okay, that's called a dominant mode of inheritance. And you have another pattern that only affects boys within the family. It's called an X-linked pattern. I have seen a family that had about 5 boys, and all of the 5 boys were affected. In fact, the only one that came to us was already almost blind, and he was just 40 years old. So retinitis pigmentosa is one of those topics that I'm not too happy to speak about, because right now, all over the world, researchers are still struggling for a solution to the disease. So what is this disease about? For people to see, we have 2 things at the back of our eyes. One of them helps us see during the night, and the other one helps us see during the day. Now, what retinitis pigmentosa does is that all those ones that help us during the night, it affects them and destroys them. And then when it finishes destroying them, it will now start destroying the ones that help us during the day. And that's why when you see patients suffering from this disease, at first, they'll be struggling to see during the night. Then later, as the disease progresses, they'll be struggling to see during the day as well. Apart from that, their peripheral vision, which is the vision that they can see while they're looking straight, begin to disappear as well until they can see through this tiny hole. It's called tunnel vision. Some of the other symptoms that they can experience is that they'll be having a lot of headaches, and they can also be experiencing flashes of light. What that means is as if you're seeing lightning, but there is no actual lightning. You're just experiencing it at the back of your eyes. Retinitis pigmentosa is a progressive condition. It is a degenerative condition. That means it just gets worse over time, despite what you do. Ophthalmologists, it's not something we like to talk about, but we have to for educational purposes, and just so that you're able to manage your expectations better. When we see these patients, the first thing we do is we have to counsel them. What it means, we have to advise, speak to them about the nature of their disease. There are some medications that researchers have found that slow down the progression a little bit, and these medications are vitamin A and DHA. Now, the problem with this medication is that the vitamin A that it requires a very high dose vitamin A. I'm talking about 15,000 units. Normally, what we take is 1,000 units, 2,000 units. But for this disease, you need as high as 15,000 units. Taking vitamin A at that level can give you some other side effects. And so if a doctor is going to place you on this, they have to monitor you very closely. They have to check your liver, they have to check your kidneys, make sure that all these things are working well. They have to make sure that you're not trying to conceive or get pregnant as a woman at this time, because taking that kind of dose of vitamin A can cause deformed babies. Another reason why it is not advisable for you to just be buying drugs anyhow is that vitamin E, which is present in a lot of antioxidant that people just like to take, is not good for people with this disease. Their vision can deteriorate very fast. And that's why sometimes, taking antioxidants is a bit controversial to us eye surgeons. We don't prescribe it for all patients, and we don't prescribe it all the time. And then finally, for patients here in Nigeria, we just talk to them about how to manage themselves as the disease becomes worse. They have to always be in an environment that they are familiar with. We can give them low vision aids. These are things like normal glasses, magnifying glasses, telescopes that help them enlarge things. We can also advise them to go to specialized schools where they can teach them how to improve themselves with only very little vision, how to sew, how they can do little things that can earn them a livelihood even without seeing properly. It's a very unfortunate disease. If you or you know anybody else that is struggling to see well at night, tell them that it's not normal and they should go get their eyes checked so that they will not misinterpret it as spiritual attack, witchcraft attack. It's just that they've not been to the right person to make diagnosis. So thank you for watching this episode, and I'll be seeing you in my next episode.